have several facilities across various institutions in Lagos State that are part of the PPP model, and you've decided to invest your business in providing this service at different facilities. What has been your motivation to doing this? And what has been your challenge in terms of investments or seeking for funds or seeking for investments to be able to put these facilities up in place?
What our motivation is actually simply to improve our vision is to improve healthcare in Nigeria. So we are ready to go anywhere, essentially to do whatever it takes to improve the quality of healthcare in the country. And as you know, diagnostics is absolutely key. If you do not have accurate results, don't have accurate and reliable results, then a lot of the doctor's skill is actually thrown away because he needs those accurate and reliable results to actually confirm his diagnosis. So this is something that we've done, and we've been able to, I must tell you that getting funding has been challenging right from the beginning, because I think right from the beginning we actually sought for SME funding. And I'll tell you that interestingly, when we went to try and get SME funding, initially we had interest from an insurance company, but then the bank part of it took it over because the government had given a regulation that the banks have to use this SME funds or else they'll all get into trouble. But the minute we went into the bank, we actually encountered a brick wall. They were not used to dealing with services, and particularly not health services. They wanted simple, where's the O? Okay, this is the stock. How long does it take to turn it over? And what if it was just, you're talking to a brick wall when you're talking about healthcare services. And they kept on asking, very interestingly, for a 3-year annual report. And we said, but we just, got incorporated this year, I said CBN requires 3-year annual, audited report. You don't give us audited report. And we actually was stopped right there. So I think there's a huge need for the banks to be a lot more flexible in terms of how they deal with healthcare services. I know that they are not happy about the fact that a lot of our health services are fragmented and they are sole proprietorships, and it's challenging because a lot of them don't have business skills, etc. However, there are ways in which other countries have dealt with it, and these are things that we can also take, cues from them. So while we're waiting for the consolidation of healthcare, while we're waiting for the corporatization of healthcare and the coming together, these sole proprietorships still need to be serviced by the banks. And the important thing is that the banks, and I'm so glad, I'm the only medical person on this panel, so I can talk to all of you. And so, Eric, you all need to really take into consideration the fact that we are in a different sector, and it's a growing and developing sector, and there are certain things that you have to amend. You talked about character, and I want to say that actually character is not just the capacity to pay. And what you talked about, George, you mentioned character. And yes, if a person does have a good character, if a person does have a good reputation, a person is of good standing in his community, that should count for something. You should be able to get referral or references from his provider associations or his professional association, and these should count, because you can't have the strict, audited accounts and all that, because they haven't been doing it. Yes, they can start doing it, but you know that if they start doing it today, it won't be ready immediately. But in the interim, what do you do for these people? And it's important that the banks develop some degree of flexibility and actually come to the table in developing new ways in which to determine the creditworthiness of our people.
Thank you very much.
I think the major thing is like the hospitals, first of all, need to see themselves as businesses. Within the social service segment, we have two major sectors, the education and the healthcare. You observe that the education sector seems to be attracting a lot more, isn't it? But the health sectors are, you can hardly see any scale. So in my view, I think the first thing that needs to be done is those in these sectors need to first of all see themselves as businesses. I do know that, because of the social nature, most of them, when you talk about investment in healthcare, you look at it from an expenditure point of view. The government is spending a lot of money. There's a lot of budget allocation, isn't it? You see, in terms of people, insurance, and all of those stuff. But for those in private, you're providing services to those who can afford it, isn't it? So first and foremost, you need to be able to build a workable business model. And that you've noticed, like most hospitals' businesses are not scalable. A lot of things are personalized. So you find that because they're personalized, you can't scale it up. Anything you can't scale up, you can't fund. Money goes to where it can be what? Multiplied. So the first thing is like you need to understand your business and build business models. And then take in terms of scalability, how can you scale this up? That's when you can begin to attract funding. Generally, there are three major sources of funding for any kind of business. I'll be talking about healthcare now. I'll talk about generally businesses. If you're in business, there are three major kinds of funds you can get. One is what we call the 10 earning. That means you're making money from your small business, you're able to save the profit, and you put it back to the business. The problem is like it might take you 5, 6, 10 years to achieve your goal. The second kind of funding is the equity kind of funding. You have a business, you want to be able to sell part of that business in exchange for capital into that business. And I think that's where most of the businesses are lacking. Maybe because of this mentality, I like what somebody said, you need not medical directors in that sector. Business is a service you're offering for a price, whether it's treatment for sicknesses or whatever it is, you're offering a service. So there's a major business involved, and there are people who have skills for that. In the same meeting, one medical director asked me, he said, please tell me, are doctors not better credit than others? I said, well, man, that is not them. He said, no, they should. I said, why? He said, because you should trust us. You trust us with your life. So you should trust us with money. I said, my friend, this is not a matter of trust. It's a matter of capacity. If I give you this money, will it come back? So if you don't have that skill to turn around business, please look for those who have. Okay? Because traditionally, people look at investment means if I put in money, I'm hoping to get what? Return in the future. So I don't really care about your services. I want to see the return come back. So you must be able to demonstrate those returns in the business. The third kind of business, the source of funding is the debt, where it comes in. And I tell you, before you go and borrow money, you must ask yourself first, can I pay? Because the moment you took that money, the interest starts. So every business that wants to borrow must know that you can pay back. And we bankers, there are basically a few things to look at. One is the character of the person or the business. That means, how have you been dealing with other people? So that's very, very key. So as you build your businesses, make sure that you're able to demonstrate that you have a transparent processes that's demonstrate character, The next we look at is ability. Are there things you've done successfully? That's also very key. And then look at the maybe the margin. The business you're doing doesn't have enough margin to pay for the cost of fund. And then of course the purpose, why do you need this money? Is it legal? Is it something I want to fund? And then talk about the amount. Is the amount you're asking for, is it adequate? If it's too much, we'll give it to you. If it's too less, we'll give it to you. So it has to be what? Adequate. To look at payment sources, how are you going to repay this money? Okay? That is very key. If you have only one customer, it might not be attractive. If you have customers who don't pay. I noticed something that's very common between hospitals and schools. I noticed that the schools in, let's say, Agege Aziz, or the hospitals in Agege Aziz behave differently, isn't it, than those in BI. So if you're in different market, you need to know what kind of market I am, and you're building those stuff. So what are the payment sources? What is the strength of that your payment sources? I'm not saying that those in Agege don't pay. Believe me, but that means you might need to do more. Instead of servicing 2 or 3 people, you might need to service what? 200 people to get this amount of money. So your operations are to spread that. And then finally, where a lot of people complain about is insurance. Insurance means what is the guarantee that if all of this things fail, you'll be able to pay back because it's a debt. And that leads me to maybe the fourth one, which is just very standard. And I think that's where we need to work harder. The supplier's credit. I know there are a lot of vendors in the healthcare sector, and I don't think they are doing enough. Because if you look at the nature of the fundings we are seeing in healthcare, they are basically, I need money to buy beauty if I want to expand, if I want to build another hospital, or I need this kind of equipment, isn't it? And most of these things are asset-based lending. The challenge is some of those assets or equipment might be a bit specialized. So the only one to understand it better is the vendor. So a tripartite arrangement whereby the vendor and the hospital and the funders are involved, you find out that things can do work better.
Okay.
So in my view, if you do all of this,
there's a need for the banks to understand that the healthcare sector is a very peculiar sector. Like Dr. Doskam said, what are we? Nigerians are very special people. So the doctors are extraordinary people in that respect. Now, based on that, the next question is going to Mrs. Njideka. And I want you to think in the context of what has just happened. Mr. Ogonai has challenged this audience that we're not very literate in the things of the financial world. And Dr. Pamela has responded that the banks are also very illiterate in the things of the medical world. So there has to be a synergy, okay? There has to be a platform where nobody is on a high horse. Everyone has to come down to identify the problem as a problem that is peculiar to a sector and as providers of a solution. Bearing that in mind, what do you consider to be the main ways of sharing the risk?
Like you said, it's a new, I don't want to call it a new environment, I don't want to call it a new terrain. We're not really illiterate, we're maybe semi-illiterate aspects. We're trying to understand the healthcare needs and how we can fund them. We had lunch together and we had a brief discussion. And part of what I told her, what George mentioned, is the fact that we have to realize as medical practitioners that it's a business. It's not a charity organization. We have to run it properly like a business. And well, doctors are here. I don't think doctors are very good businessmen. I think they're just doctors. So what they do, go into, you doctor. So you need to run it like a business. And the banks, like she said, for some time we've not been very flexible, but we're learning. It's a learning process for all of us. We've gone into it headlong now. We're doing not as much as we should do. We should do more, but we're doing something. We started making inroads into helping and funding healthcare sector. What we've done for some time, we've told them to do a little bit of capacity building for them. We need to do a lot of capacity building for not just the doctors, the nurses. We need to, as a country, get our healthcare to the level where you walk into the hospital, you get the services, you pay for the services, and you're getting value for money. So for us to get to that level where we get that proper value for money, you have to look at capacity building. It's not all about collateral. You know, people will tell you require this collateral, that collateral. It's not really about collateral. If you understand your customer's business to an extent, it's easier to lend in an industry where you really understand what they're doing. We're trying to finance them, but generally, for me, understanding, we need to understand the healthcare sector of Nigeria. We're trying to understand it, and we're learning. And as we're learning, we're helping them build capacity. That's one of the most important things we do, capacity building for the healthcare sector. And when we do that and help them to build capacity, it helps them to become, I don't know whether to use the word, a beautiful bride for bankers to lend to them, but that's what we're trying to help them to do. Thank you.
I dare say you don't have a medical officer employed in that desk, do you? Oh, you do? That's a step in the right direction. That's worthy of note. And then I think you should also have such an officer go around creating access to building strategic partnerships for you with organizations like PharmAcess. other partnerships that you can also build links to, where you can get useful data and access to all these doctors and other professionals that you need to work with in order to get the right outcomes. Thank you very much.
All right, thank you. The next question goes to Mr. Tunde Ajayi from GT Bank. The fact is, I'm quite aware of this, basically because of the information from the CBN, that only about 30% of the MSME funds has been utilized to date since inception. And the reason for this is the fact that most of the MSMEs are not bankable. Quote, they don't have they've not met the right criteria for them to be able to access the funds. And each year, the CBN, talks about this. Now, what do you think? And a lion's share of this 30% is actually in the agriculture sector, with the health sector maybe taking a very paltry part of this. Now, what do you think can be done to make SMEs bankable, a very bankable and attractive sector in Nigeria?
I think we had a meeting at CBN recently, and one of the things I said was, if you want us to give loans to SMEs, and you want us to take collateral from them, I mean collateral that is disposable if there's need, then there's no way that fund will go a long way. I say that categorically. I think for us to make SMEs within the health sector to be bankable, first we need to try and de-risk the segment to a level. The way the economy runs now, there's high risk of business. The cost of running your business is very, very high. If you had to run your generator 24 hours a day without having that, you know that cost goes back to your bottom line. Therefore, the cost is high. The risk is high. We can't shy away from that. Therefore, we need to, the government also need to come in, or other multilateral agencies. I partner with a multilateral agency on my SME funding recently. And what we do is, I have to tell them, if you're looking for collateral, we're not going to do anything. This set of people, they don't have any collateral. This risk, are you ready to go with me? If with whatever they are buying, they are ready to take it. But that doesn't mean we're just taking it as collateral